Like to call to order the Human Resources Appointment and Equity Committee meeting. Today is Tuesday, February 19th. Council Clerk, will you please call the roll?
Calling the roll, Ms. Brown.
Present.
Mr. Gallagher. Here. Mr. Jones.
Here.
Mr. Miller. Mr. Miller's absent.
He's here.
Mr. Miller is present. Ms. Conwell.
Here.
We have a quorum.
All right, thank you very much. Is there any public comment?
No one is signed in.
All right, I'll move to approve the minutes from the January 29th meeting. Do I have a second? It's been moved in second. If there are no questions, comments, or concerns, all in favor, please say aye.
Aye.
Aye. All right, the minutes have been approved. If you'll read the first item into the record.
Resolution number 2019-0038, reappointing Deborah Southington to serve on the Cuyahoga County Personnel Review Commission for the term 3/8/2019 to 3/7/2025.
Thank you very much. I understand Ms. Southington is not present and has submitted a letter on her behalf. I also understand from serving in this committee, she has been a longstanding member of the PRC commission, and it is the recommendation of the administration as well as mine to move forward with the candidates, with her candidacy. Is there any questions, comments, or concerns with regards to her appointment?
I don't have any comments, Madam Chair, but if we could have Michelle let us know what, with the three commissioners, where they're at in terms of openings and, or when their dates are up. 'Cause it's
For PRC?
Yes, ma'am.
Unfortunately, this was a county council appointment and not county executive, so I haven't done a lot of research on that. I can look into it and get back to you, though.
Is there someone here from our staff that can speak to this matter?
I think
No? Okay, all right. Are there any additional questions, comments, or concerns? No? Okay, and I actually spoke to our Chief of Staff, Joe Nani, who touched on this matter. Ms. Southington has been with this committee for quite some time and has served with honor and distinction, and so it is my recommendation that we move this item forward to the full body of the council. Is there a second?
Second.
All right, it's been moved in second. If there are no questions, comments, or concerns, all in favor, please say aye.
Aye.
Thank you very much. If you'll read the next item into the record, please.
Resolution number 2019-0042, confirming the county executive's appointment or reappointment of various mayors to serve on the Cuyahoga County Planning Commission, representing various regions for the term 1/1/2019 to 12/31/2021.
All right, thank you very much. I understand we have Mayor Michael Gamella is in attendance, but before we do that, I'll turn it over to Ms. Michelle Pomerantz so she can give us a little bit of background regarding this particular commission, and I'll turn it over to you.
Thank you. Madam Chair, the county executive is hoping that you will consider for appointment Mayor Michael Byrne for reappointment, Mayor Byrne from Parma Heights for the South Central region, a 3-year term beginning, well, it's already past January 1st, but ending December 31st, 2021, and a new appointment of Mayor Michael Gamella for the Southwest region, a 3-year term beginning January 1st, 2019 till December 31st, 2021. Mayor Gamella is replacing Mayor Kleem from Berea, who has respectfully asked that he not be reappointed due to other priorities.
All right, thank you very much. Are there any questions, comments, or concerns from the committee for Ms. Pomerantz? All right. Mayor Gamella, if you'll please step forward, share with us a little bit of your background and why you would like to be appointed to this particular commission.
First off, thank you very much for the opportunity to speak and for this appointment. 3 weeks ago, I had a total hip replacement, so thus the cane. Hopefully the next time you see me, I'll be without it. And everything went very successfully, and if you ever need one, I'd encourage it. It was a very, very, I dare say, easy process. My name is Mike Gamel. I'm the mayor of the city of Brook Park. I've been a member of the city council there since 1986. I've served in every council capacity in the city of Brook Park, ward councilman, councilman at large, and I was a council president there for 20 years. I also served as a union official with UAW Ford Motor Company. I was transferred to Detroit in 2014. There, my assignment was, we totally redid the National Program Center, which is the old Veterans Building, right in the center of downtown Detroit. And in that, we had a $15 million budget. We brought the project in under budget at 13.8. But in that capacity, I was a liaison with the Detroit City Council, Detroit Planning Commission, Detroit Historic Society, and it was all a very good education for me. But we successfully completed the project, and I would very much like to be on the Cuyahoga County Planning Commission so I can help out so Cuyahoga County can be all it can be. I think we have great potential here, and I'd like to see it come to that, and I'm very grateful for the opportunity to be a part of it. I'll entertain any questions you may have, please.
Any questions from the committee? Councilman Miller?
Madam Chair and my colleagues, I appreciate your willingness to step up and serve on the Planning Commission, and I just want to convey to everyone that Mayor Gamella has and his administration have worked very closely with me as a member of County Council, and we've forged a much better working relationship between the city of Brook Park and the county than we've had in a long time, and that Mayor Gamella is a pleasure to work with, and is the kind of person that really knows how to do the kind of collaboration and working together that we need to move this community forward. And I would give my highest recommendation to my colleagues that Mayor Gamella is the kind of person that we definitely want on the County Planning Commission. Thank you.
Thank you,
Thank
Gail.
you. Thank you, Councilman Miller. Any questions, any further questions, comments, or concerns? The one question I would ask is, and Michelle may be able to answer this a little bit better. What constitutes the Southwest region, Brook Park, and what other communities do you know offhand?
I know it's Brook Park, Berea, I think Strongsville too, am I right, Councilman Gallagher? And Brooklyn,
In Brooklyn? Okay.
yeah.
All right, thank you very much. If there are no additional questions, comments, or concerns, Mayor Gamella, thank you so much for coming. We're going to move on to our next reappointment. If you'd like to stick around, we'll move on the item after we've heard from both candidates. Our next candidate up is Mayor Michael P. Byrne. If you'll step forward, let us know why you'd like to be reappointed and a little bit of your background.
Thank you, Madam Chair.
Thank you, Mayor.
Good morning, everyone.
Good morning.
Mike Byrne from the city of Parma Heights. A little bit of the background, I served on council in Parma Heights for 10 years, 8 years as a council president. I'm in the second year of the third term as mayor in Parma Heights. I'm extremely fortunate to have served on the County Planning Commission since 2013, initially appointed by Executive Fitzgerald. It's as you know, Councilwoman Brown, it's a good committee to be working on. And one of the highlights is, and I know you've worked extremely diligent in trying to get additional funding for master plans, but how they can impact each community. And when the mayors that sit on the panel come in and relate stories of what the master plan has done to their community, what opportunities it has led to for additional financing or grants through NOAC and so forth, it's just a worthwhile committee to sit on. My background, I do have a degree in urban studies from Cleveland State, and I feel I would be honored to be reappointed to this commission.
Thank you very much. Are there any questions, comments, or concerns from the committee? All right, as Mayor.
Could I add?
Yes, please.
Parma Heights has got North Royalton, Parma Heights, and Brooklyn. And I believe Middleburg Heights is with, do you, Mike?
With the Southwest region, maybe with,
Through the chair, I have the list. Southwest area includes Berea, Brook Park, Middleburg Heights, Olmsted Falls, Olmsted Township, and Strongsville.
okay.
And then the South Central region is Parma, Parma Heights, North Royalton, and Brooklyn.
Thanks, Michelle.
All right, thank you very much. Mayor Gamella Olmsted Township keeps us pretty busy. I'll just give you a heads up with that. So with that said, if there are no additional questions, comments, or concerns, I will add my comments. It's been a pleasure to work with Mayor Burns, and I certainly would like to continue to work with him in this capacity. So it is my request that we respectfully move this to the full body of the council. We just had a meeting on we're going to need to move this
Yes.
under second reading suspension. All right, so we will move this under second reading suspension, if there is a second. All right, it's been moved in second. All in favor, please say aye. Aye. All right, thank you very much. If you'll read the next item into the record.
Resolution number 2019-0043, confirming the county executive's appointment or reappointment of various individuals to serve on the Cuyahoga Regional HIV Health Services Planning Council for various terms.
All right, thank you very much. Regional Director Pomerantz, if you will, please give us some insight and background regarding this particular appointment.
Yes, thank you, thank you, Chairwoman. Cuyahoga County Regional HIV Health Services Ryan White Planning Council represents the transitional grant area, and that grant area includes Ashtabula, Cuyahoga, Geauga, Lake, and Lorraine and Medina. The mission of the Planning Council is to plan for the comprehensive delivery of HIV/AIDS services and allocations for resources for the grant. And the goal of the Planning Council is to identify HIV-positive individuals, see what they are linked into care, stay in care, and help improve their health outcomes. Some of the services include medical case management, pharmaceutical assistance, transportation, legal support, and supportive care. And the county executive and I respectfully request the reappointment of several members and new appointment of several other members.
All right, thank you very much. Any questions, comments, or concerns for Ms. Pomerantz from the committee? There being none, the first candidate, I believe, is Kimberly, I'm sorry, Clifford Barnett. It's okay, Kimberly, I got a little ahead of myself.
Wrong commission.
Good morning.
Good morning.
If you'll state your name and give us a little bit of your background and why you'd like to serve on this council.
My name is Clifford Burnett. First of all, I'd like to say how honored I am to even be standing here. I come from a background of general management. I work for restaurants. This was brought to my attention by one of my case managers that I deal with my HIV. I've been diagnosed with HIV for almost 15 years now. But the thing that brought me to the Planning Council is how I've watched myself grow over the years, from where I was to where I am today, to my successes, to all the hard work that I put in, and I wanted to give back. You know, I wanted to show people that there was another way, and dealing with HIV isn't just like a sentence of death, and that's what a lot of people, when they're initially diagnosed, that's the feeling that you have. And I wanted to show people that that's not where it all ends. So I went to the Planning Council and I became active like right away, you know, and I learned, sat back, paid attention, worked hard, read my material, and I just want to give back. And that's really what my driving passion for all of this is.
Thank you very much. I'll open it up to the committee if there are any questions, comments, or concerns. Okay, thank you very much, Mr. Barnett. So could you remind me again how you learned about the position?
It was from my case manager.
Okay, your case manager.
Yes.
All right. And it sounds to me like you have been attending some of the meetings just as kind of get
Yes.
a feel for it.
I've been attending meetings since September of last year.
Oh, wonderful. Okay, so what, if anything, do you see yourself being able to bring to the table that might be different from what you've experienced as you attend the meetings?
Leadership.
All right, and I'll ask Ms. Pomerantz, these are new appointments. Mr. Barnett would be potentially replacing,
I'm going to have to.
Looks like a lifeline.
Yeah,
Go ahead.
can I get a
If you
lifeline?
can if you come step forward and state your name for the record.
Good morning, Chris Ritter. I'm co-chair of the Membership Retention and Marketing of the Ryan White Planning Council. We're currently not at full staffing, so it's just a appointment to,
So there's a vacancy, so he'll be filling a vacancy?
Yes.
Okay, thank you. I think Councilman Jones had a question.
Mr. Barnett, you spent quite a deal of time just observing. Could you elaborate a little bit on your observations of what you saw? You mentioned leadership. What do you see, any maybe strengths or weaknesses or things that you could bring to the table?
Some of the weaknesses that I've seen is the inability to conduct meetings that are based off of criteria, because everybody's emotional, everybody has a feeling and a say-so in what goes on, but sometimes people's feelings tend to get a little out of control and we lose track of what our focus is. And so far, my biggest focus has been bringing everybody back to the table so we can actually discuss what our issues are and how we can address them, rather than everybody talking about how it affects them. We have to think about how it affects the people that we serve.
Thank you. Thank you.
Well, thank you very much. I appreciate your candor and honesty. It's, I would venture or imagine that the subject matter can provoke a lot of emotions. And so if you find yourself in that situation and being able to steer the ship back to the agenda, I think that would be very useful. So thank you very much. Our next candidate, I believe, is Michael Deegan. And if I'm mispronouncing that, please correct me once you step forward. And if you'll state your name for the record, give us a little bit of your background and why you'd like to be appointed to this council.
Good morning. My name is Michael Deegan. I have been aware of this council since it was run by the city of Cleveland. So as a long-term survivor of HIV and AIDS for over 30 years, I would like to, because it's helped me through many of those years, give back to that. And also be able to participate in the way that these funds are distributed from the point of view of a consumer. And I watched a lot of my friends die over the years, back before Ryan White was really there to help them and medication assistance. So all that's really important to me, that this continues to be a viable option for our community here. And the legacy of Ryan White and those early activists is continued to be disseminated, because a lot of young people don't even know who Ryan White was anymore. You ask them where they get services from. Ryan White, do you know anything about it? No. Do you know who he was? No. So that's important to me. I've run a small business for about 30 years. So, I have some skills in money understanding, management of funds. So basically, that's why I would like to be on the council.
Well, thank you, Mr. Deegan. I'll open it up to my colleagues. Councilwoman Conwell.
Through the chair to Mr. Deegan, do you think you will play a role in igniting and really getting the young generation to know about Ryan White? Do you think you could play a role in that?
Possibly. I mean, someone needs to convey that history to them, yeah.
Thank you.
Absolutely.
Any other questions from the committee? All right. Well, we thank you very much for your willingness to serve and coming out this morning. Our next candidate.
Thank you.
Thank you very much, is David Johnson. Mr. Johnson, if you'll state your name for the record and a little bit of your background and why you like to serve.
Well, good morning, Madam Chair. First of all, my name is Robert Watkins, and I'm representing David Johnson. He's unable to be here with us today. David Johnson, I've known David for about 25 years. He's always been an intricate part of the community. He's actually a puppeteer. you know, like they do with Jim Henson and stuff. And he also has worked with the Cleveland school system with the kids, the babies, and doing puppet shows all over the city. And as of recently, about the past 3 or 4 years, David has shown an interest to me as far as HIV is concerned in the community. This is close to his heart. He's wondering, how can I touch the youth? And how can I get this information out? Because they don't teach it in churches. They don't teach sex education in schools. But he came up with this concept to put these little hand puppets together, and he was able to actually teach it. And I watched him do this live. And I'm like, David, you have a great gift, and you're using your gift for the better of our community and to make things bigger and better. And he says, well, Robert, you know, I really want to do more. And so I invited him to come to Planning Council about a year ago. And he's been sporadically coming to the meetings, but now he's really, really serious. So, and he's not able to be here today. I think he was had a couple doctor's appointments today, so he wasn't able to be here. But I said, I'll be happy to represent you. And he'll be a wonderful person for the community.
And Mr. Watkins,
Yes.
I appreciate you coming forward, speaking on Mr. Johnson's behalf. What capacity and what role do you work with the council, or do you have some background in this area?
Absolutely. I'm on there too. You'll be talking to me soon.
Okay, all right. So you're one of the reappointments.
Yes.
All right, perfect. You're the last of the ones on the
Yes.
reappointments. Okay, I'll open it up to my colleagues if there are any questions. Councilwoman Conwell.
I'd just like to share that David Johnson, I have seen his puppeteer show.
Absolutely.
And he is, it's not the hand puppets, but it's the ones on the
Marionettes.
strings.
You call them marionettes with the ropes?
Yes, I didn't
Yeah.
want to say that wrong. And he's phenomenal
He
in what
is.
he does. So very glad to have him on this, and maybe we can have him do a show one day.
Absolutely.
Thank you. Any other questions, comments, or concerns? All right, thank you very much for speaking on his behalf. Our next candidate, I'm not sure if he is present. I have Ronald Rowling. All right, Mr. Rowling, excellent. If you will step forward, I think we got a statement or email that you might not be able to make it, so I'm glad to see that you are here.
Yes.
And if you'll state your name for the record and why it is you would like to serve, along with a little bit of your background.
Well, first of all, I'd like to thank the council for inviting me in today to speak on my own behalf as to why I feel I'm a viable candidate for the Ryan White Planning Council. My experience goes back well over 30 years in working with the community. I started fresh out of high school working for the Council for Economic Opportunities here in Greater Cleveland. I did 15 years working for the Cuyahoga County Sheriff's Department, some good days, some bad days. I am also a licensed clergyman here in the city of Cleveland, although I'm not pastoring at this point in time. My passion for those that are living with and affected and infected by HIV goes back to my own personal experience of 20 years. I have been involved in a number of other organizations such as Case Western Reserve University's Community Advisory Board, the AIDS Task Force of Greater Cleveland, and most recently the Regional Advisory Group of the City of Cleveland Health Department. I have a passion for Ryan White programs because I believe in giving back to where I received help from. Each one, teach one is my philosophy. And I firmly believe that if no one is talking, then no one is listening. So our job as council members is to get out there amongst the people and break the stigma, because there's a lot of stigma still surrounded by the HIV disease and the concept within itself. And with that, I'll open up the floor for any questions you might have.
Thank you very much. I'm going to ask my colleagues if you have any questions. No? All right. The one thing that I wanted to ask, you mentioned that you have, how did you come to know about the position? And I didn't ask that.
I
about
was
some of the
actually
others.
invited to a commission meeting by Robert Watkins. He is very vocal
Okay.
within the community, and he notices people for their strengths, and he will hound you until you give in. So he just about on a weekly basis, we need you on Ryan White. You need to come to the meetings. And so finally I broke down, and I had not been going because I was working. Unfortunately, I came down with chronic kidney disease, and so I'm no longer working in that capacity. So that freed up a lot of my time to be able to do some other things within the community. So I went to a meeting and I enjoyed it.
Mm-hmm.
And so over the past couple of years, I've gone to a few meetings. More recently, I've become more active with that particular committee. So
And having attended the meetings, what would you like to bring to the council that you see might be an additional value to the council?
Education. Again, there's a lot of stigma that still surrounds the disease, and people need to be educated that it's not a death sentence anymore. It's a manageable disease, just as any other disease is.
All right, thank you very much. If there are no further questions, comments, or concerns, I thank you for coming down and your willingness to serve as well.
Thank you.
All right, we're going to move to the reappointments. The first name I have before me, and we'll move in order of the agenda, is Terrence Allen. Our very own Terrence Allen, if you'll state your name, and thank you for coming before us today and why you'd like to continue.
Thank you, Madam Chair, members of the committee. I'm a bit under the weather, so I apologize for my scratchy throat, but I think the distance is appropriate from a public health prevention standpoint. It's been my honor, a number of the folks that are with us today, my honor to serve with them. It's been a learning experience for me. The Cuyahoga County Board of Health serves on behalf of the county executive as the administrator for Ryan White. We've been doing it now for about 7 years. And this is a reappointment for me as a co-chair of the committee among 3 co-chairs for the group. They are, and I've been in public health for 30 years, they are the most committed, most passionate group of people, and many of them volunteers. Their own time and their experiences they bring to the meetings. As Mr. Barnett stated, the meetings can be spirited. And that spirit is channeled because of the passion that people feel about the issue and the importance of needing to be heard. And we have moments where passions flare, but we also have moments, I think, and many more moments, where it is an honor to be in the room and listen to folks that are close to the ground, that are living with HIV and AIDS, that are treating folks and helping folks that are living with HIV and AIDS, and their commitment to the work. And in terms of community engagement, there's a ladder of engagement from where in an emergency, a government agency may lead, as an example, at one end of the ladder and basically dictate in terms of response that I've been involved with. We have the other end of the ladder where Ryan White is organized, very much where there's administration, but the role of the council is to decide how the funds should be used based on the wealth of their experience. And Ryan White is the best example, I think, that I've been involved with the community engagement. So I wanted to offer, if I may, a few examples of what we do very briefly. The talk was given to council in the fall, but there are about 5,700 people in our region here, 6-county region, living with HIV and AIDS that are part of Ryan White program. 204 new cases were diagnosed in 2017. We're still doing analytics around 2018. 29% were below the age of 30 at diagnosis. The highest number of new cases in the region were the 25 to 29-year-old age group. In the county, it's among 30 to 34-year-olds, and the new cases, among the new cases, 39% were African American. One of the things that I think the group is very proud of is if we look at the general population of insured individuals that are living with HIV and AIDS, we know that if you are diligent and you're in care and your care plan is managed well, and you're taking your medication, we know that you can be virally suppressed to the point where you are no longer capable of transmitting HIV. And so it's important to recognize that. So it's a you versus you, undetectable, is a campaign around assuring that untransmittable, undetectable, untransmittable. And so in the general population of insured individuals, something just under 60% of people have their viral load suppressed to that point. In the Ryan White program, and this is something that I talk about every chance I get when I describe the program, over 85% of people in the Ryan White program are virally suppressed. And so they are in a position of being undetectable, untransmittable. And that's pretty amazing. That doesn't happen in public health very much. And so that's something I'm very proud of and proud to be part of. The last thing I'll mention, and I'm sorry for taking too much time, is that very recently at the State of the Union, there was an announcement made to eliminate HIV in the United States. I know that the director of the Centers for Disease Control and Prevention has mentioned this several times over the last couple of years. And so now the Health and Human Services, Department of Health and Human Services is taking comments on what that might look like. But they have a four-pronged approach that has emerged. No, not the details at this stage, we're still learning. And so it's rapid diagnosis, early diagnosis. There are lots of people living that are unaware that they have HIV. It's treatment, as I described earlier, the importance of treatment and adherence, and providing the medication to make it as widely available as possible to those that need it. The next is prevention. Pre-exposure prophylaxis is a known methodology and treatment to assure and prevent treatment. And the last is the idea of expanding workforce capacity. So those are the four prongs that have been brought forward by HHS. And we'll see going forward how that will have an impact on our county. There are 49 counties in the United States where the preponderance of cases are diagnosed, and we are one of those. And so we will be included in this new approach, along with Puerto Rico and DC. And so we'll have to stay tuned to determine what that means for us. But I think it's a chance for us to really, on the Ryan White side, we are involved in the care side. But it's a chance for us to come together with the prevention side at the Cleveland Department of Public Health to really to come together to move toward this goal in a decade of elimination. So with that, I appreciate your consideration for appointment and appreciate the chance to speak to you.
If you would, for me and maybe the rest of the members of this committee, just send us some of those stats that you shared with us, particularly. You touched, I think you said 29% of the new cases are under 30. Is that?
Yes, that was, I believe, the statistic. I can forward you our Vinos and Draram, our epidemiologist, recently provided some data, and so I'll forward those to the council for your consideration. And if ever, I think I can come as a public health figurehead, but these folks are the ones that live and breathe the work and understand it and teach me every day new things that I need to understand. And it's been a very rewarding experience for me. So I'll be happy to provide the data.
And the other, I guess the question that came to mind is the other 70%. Is it just a smaller portion of every other age demographic or is that the largest demographic?
That's the largest demographic in Cuyahoga County. That's for the region. In Cuyahoga County, it was 30 to 34 age range. I think something on the order of 30%. So yes, those are the range. So then 25 through 34 would represent probably the largest preponderance of a point of diagnosis. But I'll provide the specifics to you.
And I noticed today all of our candidates were African-American males, and you touched on the African-American new cases. What was that percentage again?
That was 39%.
39%. All right, and I'll open it up to my colleagues if you have any other questions. Councilwoman Conwell.
Through the chair to Director Allen, has there been any changes in funding to the Ryan White?
Well, I think our funding has been, and we've been, I would say also very happy to say that when dollars come to us, we use those dollars to assure that we are using them in our region. We've been very good about that. There's a small carryover that's allowable, and we've stayed within that to assure that the dollars are being used effectively in the region. We have had supplemental funds that have emerged from the state health department, sort of one-time funds with dollars I had available to help to expand the work that we do, but it's been fairly stable. It's our sense that with this announcement of this elimination plan that there should be additional dollars that will flow, and how that looks and how it's organized is still sort of an open question, but recently released by HHS, they're looking for comments on the National HIV Strategy that was released last week. So our council will be members, perhaps together and also independently. Folks will offer their ideas on what that should look like, and I would expect an infusion of dollars in some way, shape, or form and we're hoping to have some input on what that looks like.
And how is it funded now?
Right now, it's funded through the Health Resources and Services Administration at the federal government under Health and Human Services.
Thank you.
Miller, Councilman Miller?
Thank you, Madam Chair. Director, is the total caseload currently increasing, decreasing, or staying about the same?
Well, I actually looked just over the weekend here, and in Cuyahoga County, the number of newly diagnosed cases have gone down over the last 3 or 4 years. I did see some data from the Youth Behavior Risk Factor Survey showing that there's been a decrease in youth with condom use when having sex, and that's a concern about transmission. So that also is on the education and the prevention side. So there's two components to this. The treatment and connection to treatment, as Mr. Ritter is fond of saying, that we can treat our way toward elimination. And I think that that's an important consideration. But prevention, as we know, prevention and care go very closely together. The downward trend is certainly promising, but I think we need to remain vigilant.
And Director, is medication for HIV generally available throughout the world, or are there countries where HIV is still very prevalent and not being treated and basically not under control?
I can only speak in general terms on those issues. Councilman Miller, I do know that PEPFAR is a federal, I think was started actually by, Presidents George W. Bush, as I recall. And PEPFAR was a federal program. These folks can wax poetic on a lot of the issues, and so I feel inadequate answering your question, so I'll be brief. The program was designed to try to make medications available more widely around the world for antiretroviral drugs, and PEPFAR was the pathway to do that, and it's been in place, I think, since that time. But others perhaps will have a greater detail on that than I can provide you right now.
Councilman Jones?
Thank you. Mr. Allen, what is the budget?
The budget is somewhere in the order of $4 million and some change, essentially. It's been fairly steady. We did get an infusion of several $100,000 that came from the state health department as a one-time addition. And so the challenge often is that the money comes in waves, and we get it in installments, and it requires us to recontract and revise contracts, and a tremendous amount of work goes in from our staff. Melissa Rodrigo from our office does I'm amazed at the amount of work that she and her staff do to try to coordinate this to assure that money flows. And the council's job is to then decide how those dollars are used. And that is in terms of across a range of service categories. And so understanding and hearing from the different services that are offered, the folks that represent those services and the needs of the community, the idea then is to move dollars, anticipating how dollars are being used into the categories where they could be used most effectively. And every year we go through a process of trying to make those determinations where we try to understand the scope of the need and make determinations on how to best use those dollars across the service categories, and to then assure that we have the right range of service categories that are available to meet the needs, and also don't want to be duplicative where there may be other resources in the community, and Ryan White would be better advised to redirect dollars to places where they could be used better.
Where has Ryan White found themselves most effective? As you mentioned, potential duplications in other areas.
Mm-hmm.
Where is your wheelhouse, so to speak?
Well, I think the demonstration around care, specifically looking at the fact that we have that high percentage of folks that have their viral load suppressed, so they're able to prevent transmission. I think that's pretty remarkable. There's a whole range of other categories, and we have members of the Planning Council that connect in the community with folks living with HIV and talk to them about the types of services they need and where they identify gaps, and that personal experience is brought back to the council. I think that's an important way for us to stay connected, and I'm really excited about the new membership that's joining us as well. I think it's great to see, and again, I just would last say that I'm very proud to be part of this work.
Within your budget, what percentage would you say is the administrative costs?
There's a limitation on the administrative portion by HHS, and we are under that amount. I'll need to send that to you, but we are under our cap. We've been, yes.
Okay. Last question, the federal dollars, are they one-time payments also, or is it different?
So the federal dollars come to us on an annual basis. And so the problem is, depending on how, as we know, how the federal budget rolls out, such as it is sometimes we will get payments in several installments, and that makes it very complex to deal with a whole range of several dozen groups that provide services. And so we have to then bring back the contracts and revise contracts and adjust contracts based on how the expenditures are going forward. So it's very uneven and it's very unpredictable. But we try to do, our staff tries to do, and I think does a great job of trying to address the needs of the community and to try to adapt and be efficient from the administrative side.
Thank you.
Thank you.
Are there any further questions for Mr. Director Allen? All right, if there are none, thank you so much
Thank
for
you.
your wealth of knowledge and information that you shared with us. Clinton Droster, and if I've mispronounced that, please correct me when you come forward and state your name for the record and why you'd like to continue to serve.
Good morning.
Good morning.
I'm Chris Ritter. I'm co-chair of Membership Retention and Marketing. So I'm from the committee that has responsibility for the slate of individuals that we put forward to the county. I'm here to speak on behalf of Clinton. Clinton's currently dealing with some health problems. I'm not sure whether he's in the hospital or recouping at home, but he's had to take a little time off, which is rare for Clinton. I've served with Clinton since I've been on Planning Council, and I think I'm in my 11th year. Clinton is always one of the first people to volunteer to do something maybe in a work group, because as everybody knows, everything's done in committee. And what isn't done in committee is done kind of in work groups of people who peel off and want to work on something so we can make some headway moving something forward. So Clinton's always one of the first to volunteer for that. He's also, through some guidance that we got from our funder, track attendance in both our main planning council meetings and in our subcommittee meetings. And we made it so that people can actually attend other subcommittee meetings to make up points for missing their main subcommittee. And Clinton consistently goes to other meetings even though he doesn't have to. So Clinton's attendance is probably at or over 100% attendance of the attendance that we score. So going to one planning council meeting and your one subcommittee meeting every month would be 100%. And if anything you go to extra kind of gets scored in along with that. So he's consistently at more than he needs to be in the room, to learn the knowledge, and to then formulate an opinion that helps to drive policy.
Thank you very much. With that said, how often are your meetings? How often do the meetings occur? Both council and subcommittee meetings?
So beginning next month, we meet on the first Wednesday of the month for our subcommittees, except for quality. Quality meets on a different day, so we meet on the first Wednesday of the month, and then our full planning council meeting is on the third Wednesday of the month in the evening. And we don't meet in the month of December, and we technically don't meet in the month of July, although we usually have some other obligation in the month of July that occupies people's time, like where we actually put the stats together to formulate our grant request. So we kind of sit and do a workshop, and at the end of the day, we give Terry's people this is what we want you to ask for. This much money spent across these categories, and we do that in July. So we meet 11 months out of the year.
Okay. Any other questions from the committee? All right, there being none, I'm going to, since you're up, I'm going to go a little bit out of order here and just give you an opportunity to speak on your own personal.
On my own behalf?
Yep.
So thank you for giving me the opportunity to speak before you. My name's Chris Ritter. Like I said, I'm the co-chair of Membership Retention and Marketing. I am also, I think, one of only 2 members of Planning Council that don't reside in Cuyahoga County.
Okay.
I reside in Lake County. I reside in rural Lake County. So I'm almost in Ashtabula County. So one thing I bring to the council is more of a non-urban representation to council, and just a non-Cleveland, non-Cuyahoga County representation to council. You know, even though we're a small percentage of the people, we still have to look at delivering parity and care. So it's pretty hard to deliver parity and care to someone in Conneaut or in Elyria across such a big area. You know, I forget how many, it's 1,200 square miles or something last time I did a thing. So that's, you know, one of the things that I work to bring. I also have 11 years experience sitting on Planning Council. I probably have some of the best institutional knowledge of how Planning Council works, how the grant is developed. I bring to the table, I know you were asking some questions of Terry about some statistics and stuff like that along those lines. And I've recommended, and we're getting ready to implement it, of doing a yearly state of HIV letter to the elected officials. So it would be this body, it would be Mayor White and the council, it would be our U.S. Congress representative, it would be, you know, the state representatives, so people understand how this disease is impacting our community and how we can leverage funds. The other thing, you know, that's one part of what I wanted to bring to have done. The other thing is we want to work towards having something along the lines of an HIV czar, for lack of a better term, and whether that's a fictional kind of person, but where we have a standard direction we all want to go in this part of Ohio. We want to head this way, and we'll need people like you folks to get on board and support us doing that. And the reason we would want your support doing that, and this was like outside of Ryan White, potentially, so that we can use the fact that our elected officials support what we're trying to do, so that our partners, right, community partners, can then use that to leverage with people like the Gates Foundation to get money. So we can actually really get where we need to go, and that's no new infections. So.
Thank you very much. Any questions, comments, or concerns from the committee? All right, the one thing I would ask, you're in Lake County, and if you have it at your disposal, if you could just maybe provide us also with some of the statistics around some of the, and you could send that to our clerk if you have that available.
I would gladly do that. Yes,
Okay.
I'll follow up with that.
All right. Thank you very
Thank
much.
you
I
very much.
appreciate your knowledge and time as well. Next up, on the agenda was Brenda Glass, who I understand is not present and could not attend today due to illness. Also, I think next we have Merle Gordon, who submitted a statement on her behalf. The name might ring familiar to some of us as the former mayor of Beechwood, but that is not who this individual is. That is a separate and different person. So as you can identify from the statement that you should have in your packet. Next, we have Tammy Jones. And Mr. Allen, I understand you will be speaking on behalf of Ms. Jones, who is out of the office until the end of the week.
Thank you, Madam Chair.
You're welcome.
Tammy is a member of the Cleveland Department of Public Health. She works for Merrill Gordon, who is the Director of the Cleveland Department of Public Health, your previous consideration for appointee. And Tammy is involved on the prevention side as we were involved from Ryan White on the care side. And they do a lot of detection and contact tracing work that happens through the Cleveland Department of Public Health. She also is involved with a program called HOPWA that is tied back to housing-related services for people living with HIV and AIDS. And we meet periodically in what we call a regional advisory group that involves prevention and care that I think will be an important conversation in this elimination discussion that's emerging at the federal level. Tammy's been on the council for some time and comes with the knowledge and the some of the community connections that I think also help to support the work we do.
All right, thank you very much. Are there any questions, comments, or concerns from the committee? All right, thank you, Mr. Allen, for speaking on her behalf. The next candidate before us would be Tina Marbury, and it looks like Chris is coming before us again. So, Mr. Ritter, if you will state your name, just for the record, and on whom behalf you are speaking this morning. So.
Thank you. Chris Ritter, Co-Chair Membership Retention and Marketing Subcommittee of the Ryan White Planning Council, and I'm here to speak on behalf of Tina Marbury. One thing I should make clear to this body is that by federal regulation, the membership of the Planning Council needs to, as closely as possible, mirror the epidemic. So that means that if there's a preponderance of people of color impacted by the disease, we need to have people of color at the table. As well, if it's impacting women, we need to have women at the table. So Tina's an African-American woman. African-Americans make up about 50, I think almost 50% of the people in care in the county or in the city of Cleveland. Women account for about a third of people with HIV. So Tina meets those characteristics. She's a reappointment. She brings to the perspective women and women of color and things that are challenges for women and women of color at the table, brings those to our attention so that we can work on health disparities related to that demographic. And she's been serving on Planning Council, and we, as Membership Retention and Marketing, we put forward her nomination to serve, and proudly so.
Thank you very much. Councilwoman Conwell?
Through the chair to Mr. Ritter, you mentioned a key point. You'd like to have the demographics mirror what? So do you have any youth? We learned of the statistics earlier, so how are you doing on the youth component?
Youth. I don't know if the county has any commissions that, goal is to have youth on them. Having youth is a challenge. I think it's more of a challenge today than it was 20 years ago in HIV care. Because 20 years ago, people were sick. People weren't working. Now, the goal is, with the healthcare the way it used to be when you got an HIV diagnosis, the first thing you do is go file for disability and file for Medicaid. So we used to send people this kind of conundrum of, you need to file to not work, but you really could work. So it was a very mixed signals that people got sent. Now, people are kind of said, continue doing what you're doing, continue going to work, just take your pills. And so people are working, and so their availability is better. Their outlook on life is better as well, right? It isn't all doom and gloom. It isn't, well, I'm not going to live, so, So people are busy, people are living lives, young people are living their lives. So we struggle with that. I'll be very honest. We struggle with that. We just set off our new targeted populations to serve on Ryan White. Youth is right there at the top. It's youth and people of color in those age ranges that, under 40 for sure. And so, and if you look, I was just kind of, as someone who's, working and filling these spots, I look at who you appointed to your commissions or thinking about appointing to your commissions. They don't really mirror the population either of the people who live in their cities. And so we have the same challenges. The average age of people who serve on planning council are probably now a little bit younger than me, but the average age is probably 50. Because that's when people, their lives kind of start to get to a point where, the kids are getting a little older and they can give back a little bit, and we suffer the same thing. So, but we do strive to get young people at the table. We also strive to get another demographic that's been very hard for us. We have a mandated spot that we should have someone checked off who's previously incarcerated within the last 3 years. And so a person who's previously incarcerated within the last 3 years gets out of prison. I'm not sure serving on Ryan White is like right up there as their priorities of what they want to do, right? They want to try to not reoffend. They want to try to get a job. They maybe want to try to reconnect with their community. And serving is not right up there. So we struggle with that demographic as well. But we're cognizant that those positions, we need to strive to try to fill them, and we do.
How many vacancies do you have? Because I know this council is about 30 individuals.
Yeah, our bylaws allow us to go as high as 35, and I think we're going to be at 29 after this round.
Okay, that's good.
All right. Thank you very much, and I appreciate you referencing the fact that while some of the individuals who have been recommended today are unable to attend, they do help fulfill some of the legal requirements of the council. And although they are unable to be here today, it is important that we take them into full consideration because of that key point that you made. So the next individual is Jason McMinn. And if you'll state your name and why you'd like to serve and a little bit of your background, please.
Thank you very much. My name is Jason McMinn. I am a social worker. I work at Metro Health Medical Center, and I work in the HIV clinic there. I've been there for 15 years in the HIV clinic, and I have enjoyed every minute of that, working with patients in the clinic, helping patients get medication, helping patients get health insurance, helping patients get housing, food, and then also providing them with support and care and connection are things that we do very well as medical case managers in our community. On top of that, an extra level of advocacy has been the Ryan White Planning Council. I was on for the last 3 years and seeking reappointment. I have enjoyed that time on the Planning Council, and it gives me a chance to take my advocacy and support to another level. Direct service is what I really love to do, and then this gives me the chance to connect to the greater community, how we provide services, and letting Planning Council know what I see directly from patients as their needs, their barriers, and then how we can leverage Ryan White funding to end those barriers and address any gaps in services.
All right, thank you very much. I understand Chris identified the state of HIV as something that he would like to or plans to move forward, an initiative of his own that he has strongly got behind. Are you also supportive of that?
Oh, absolutely, yes.
Okay.
Stigma is still probably one of the greatest barriers that patients face, their connection to the community and then the community accepting and understanding HIV as it is today. So the more promotion, the more education that we can do, that's really what's needed to connect people and make them feel like they have support and they're not so isolated.
Thank you. And having served on this body for 3 years, is there a specific initiative or something that you would like to or can point out as a member of this body that you've gotten behind or initiated?
So I am a co-chair of the Quality Committee. That's kind of how I give. I also believe that my attendance percentage is well over 100%. I like to go to all the meetings as I can. Being involved in every committee, then you know, because as Chris said, the work is done in the committee. So you know the full work if you attend every committee meeting, so I try and do that. Testing and keeping people in care are really important aspects that I try and bring to the table. We have a lot of people that don't know their status and trying to figure out who they are, where they are, and how we can support testing in those communities are things that I like to work on.
Thank you very much. I'll open up to my colleagues if they have any questions, comments, or concerns. Looks like there are none. I thank you for your coming
Thank you
out
very
this
much.
morning and your willingness to serve. And last but not least, Mr. Robert Watkins, if you'll step forward. And we had an opportunity to hear from you on behalf of one of our previous candidates, but if you'll just give us a little bit of more of your background and why you'd like to continue to serve.
Thank you, Madam Chair. It's good to see you all again.
Welcome back.
This has been a journey for me. As of this month, 35 years, HIV positive. I remember sitting before you in the last time I was here when I was first nominated to be on the committee. And I thought to myself, there has to be a way to break stigma. That was the thing that I dealt with for my young years in 24 when I was blood transfusion. So I didn't get it the way most people get it. And so I had to be a voice, but still stand strong for the cause. And HIV has totally changed since those days in the 80s to what it is today. And we're still dealing with the same stigmas. My passion today is, as Mr. Barnett said, is to get education out. Because education is the way we're going to empower the community to move forward. With HIV, AIDS, we don't hear too much about AIDS anymore, but HIV is very prevalent in our county and other surrounding cities and other states. So how do we do that? To put a positive spin on it, there's something called U equals U. There's several members that has already mentioned this. We have known for the past, at least since 2014, that if you are diagnosed and you take your medication, that it is non-transmittable once you reach a low viral load or almost no viral load where it's undetectable in the test. But no one knows it. No one's talking about it. Schools are not talking about it. Administrations are not talking about it. Hospitals are not talking about it. Doctors are not talking about it because they don't want to be held accountable for any reason if someone happens to become positive and they are undetectable and they have a partner that's not. But we know the science says 0%, but we really can't say that. That's a stigma breaker for people who are positive like me. But this message is so hard to get out, and here we are in 2019, and no one really knows about it. So that's my idea to push that. We're looking at prevention is treatment, right? We've done that 30 years, condoms, PrEP, pre-exposure prophylaxis. But we're now looking at if you treat the person, that's prevention as well. It's called TASP, treatment as prevention instead of prevention as treatment. That's also a stigma breaker. So we can get people tested or not afraid to be tested. And that's what I do in my capacity at Recovery Resources, is where I'm currently employed as an HIV peer advocate support specialist. A big word to say, for persons diagnosed positive, I take them step by step from picking a facility to be treated, picking a doctor, getting on medication, medication adherence, to becoming undetectable. That's a journey. And I'm here to take them step by step, hand in hand, drive them to their appointments, introduce them to doctors, introduce them to practitioners and nurses that they can trust. And hopefully we can work that way. I'm one of only one people that in Cleveland, Ohio, that has this position on the grant that we're doing through the CDC. This is a 5-year program. We're in the 4th year now. When I came aboard, my supervisor at Recovery Resources encouraged me to start with Ryan White Planning Council. And that's why I'm here again today. Hopefully we'll keep that grant going for 5 more years. But I most definitely want to be a part of Ryan White because it makes a difference to have a voice for people who can't speak for themselves.
Thank you very much for sharing your background and your experience. And this is still new to me, a lot of the information. So have we eliminated the risk of getting transmittal through blood transfusions? Is that completely eliminated?
The beauty of it is, in 1996, we came out with antiretroviral medicines, which is the medication that stops, if you become positive, you take the medication and then you can become undetectable. So, but prior to that, like the early 80s, Ryan White is the reason why we exist, because he was a hemophiliac. He had a blood disorder. He got a blood transfusion as a teenager, and he transitioned in his life here at the age of 18. He got it when he was 14. But it does not exist in the blood supply now because it is cleaned up. People who are diagnosed, when they go in to get a blood or get a plasma exchange or, donate plasma or blood, they test the blood now. So it is absolutely 100% clean.
And you spoke about the trying to get the message out. And again, pardon my lack of knowledge, if you will, but I recently saw a pharmaceutical ad that kind of promoted that you can, the reduction of risk for, I believe it was HIV and AIDS. Is that something that is relative to what you're talking about? And I guess is that, it seems like it would be helpful to the message that that it seems like this body is struggling to promote. Can you touch on that at all?
Absolutely. Listen to how you just presented that. To reduce the risk of, there is no risk. With U equals U, you take your medicine, you become undetectable. There is no risk. It's how we present the message. And we've been doing prevention for so long that treatment has not been a part of, like Jason said, care is going to come into the picture. But care is treatment. So treat people who are positive, take away the stigma. People want to be afraid to come get treated because once you get treated, there is no risk.
And I guess I phrase it that way to your initial point is because the pharmaceutical companies or the medical industry doesn't want to be liable in the unlikely event that does occur. So that's how it was. I believe that's how it was promoted. I might be incorrect, but I believe that's how it was promoted because it kind of caught me by surprise. Like, wait a minute, what? So.
Well, actually, it's twofold. I can add another part to that. Being candid and open about it. It's about the money. You find a cure, pharmaceuticals won't have anything to treat.
I hear you. Loud and clear. Any other? Yes, Councilman Gallagher, any other questions?
On your journey, have you ever had the fortune of meeting up with Dr. John Kerry at all?
Absolutely. John Kerry from University Hospitals of Cleveland.
Yeah, he was a friend.
Yeah. I think I shared this with someone on the council last time I was here. John Kerry with Victoria Cargill. She was one of the headlining doctors at that time, back in the 80s. Stopping AIDS was my mission. SAM was the name of her program. And Dr. Kerry came aboard around that time, and they worked hand in hand. Dr. Cargill was my doctor in the early days. And it was just heartbreaking. Here I go emotional again. I knew it was going to happen. Dr. Kerry was phenomenal in what he did because he was the people doctor.
Right.
He cared for people. It wasn't the disease. He cared about the disease, but he cared more about the people with the disease. So you could talk to him about anything.
Yeah, he was a dear friend.
Yep.
Thank you.
You're welcome.
Councilman Miller.
Madam Chair, what are the side effects of the medication and how severe are they?
Thank you for asking that question. It's different for everyone. There is some side effects that most people will experience once their immune system starts to transition, once HIV starts to take over the system. It's like a flu-like symptom. It pretty much feels like the flu for some people don't even get a symptom, but it does when you get it. 2 weeks of fever, nausea, sometimes sleepy, no energy, and then it subsides. It goes away. So you may think you may just had the flu. There are other things that actually happen to others that don't get any. I didn't get any. I actually was diagnosed in 2003. The word we used back then, full blown. I didn't even know I had it. But we traced it back once I was diagnosed at Cleveland Clinic Foundation. And so I had been an advocate because I lived in New York at that time, and people were dying all around me. But I didn't think I had it because I didn't have, watch the word I used, the risky behavior, so to speak. But here I stand before you today. I didn't have any symptoms, but I saw people go through some symptoms, so that's about the clearest I can say. It's all individualized because all our bodies are different.
Okay.
Any other questions, comments, or concerns? All right, thank you very much. When the candidates come before this body, I always mention in high school I was a advocate for stopping AIDS is my mission. So I could certainly, I certainly have a passion and interest, but I admittedly I have not kept up with the knowledge and some of the changes that have advanced for the betterment of the people involved or affected and infected by the disease. So I'm happy to see everyone's willingness to come and serve in this capacity. And I understand that these appointments started back in February 1st. So I'll move this for the full body of the council under second reading suspension. Do I have a second?
Second.
All right, it's been moved and second. If there are no questions, comments, or concerns from the committee, all in favor, please say aye.
Aye.
All right, thank you very much. If you'll read the next item into the record.
Resolution number 2019-0044, confirming the county executive's appointments of various individuals to serve on the Commission on Human Rights for the term 3/1/2019 to 2/28/2021.
All right, and our first candidate up is Kimberly G. Barnett Mills. But before we hear from you, I'm going to ask if Ms. Michelle Pomerantz will give us a little bit of background.
Thank you, Madam Chair. The Commission on Human Rights was established in 2018 to promote principles of diversity, inclusion, and harmony in the County of Cuyahoga through education, community events, the provision of advice to the County Council and Cuyahoga County Executive, and through receiving and resolving complaints filed under this title. The Commission on Human Rights will ensure equal opportunity and treatment for all citizens of Cuyahoga County. And the three commission members are here today.
Thank you very much. And if you'll state your name for the record and give us a little bit of background and why you would like to serve on this commission.
Thank you. My name is Kimberly Barnett Mills. I thank you for the opportunity to come in to talk to you about a potential appointment to this commission. I'm sure you've all seen my resume and I won't go through it again, but I will tell you some highlights about my legal experience and the things that I've done to help the citizens of Cuyahoga County and the city of Cleveland. I've committed my legal career to public service as a public defender, a prosecutor, and now as a legal aid attorney. I've had the privilege of representing those who didn't necessarily have a voice in the system. Unfortunately, pro se applicants, both in criminal and civil realms, their voices are discounted and unheard. And I've had the privilege to represent people and help them through that process. If appointed here, I would also make sure that there is full accessibility for everyone to come here to get information, have their complaints heard fairly, impartially, and be understood in the process without needing a lawyer, because I think that's key. People need to know that they can come here and be heard on their own and to be seen on their own for what they bring, not with the need of counsel. Although I appreciate being a lawyer and being able to help people, people should be able to do this on their own. I've seen what happens when people move forward on their own without counsel. Additionally, as a prosecutor, I work toward justice for all. So I've dealt with clients both as victims and as defendants, and some days those things interchange. I've worked really hard as a prosecutor to make sure that we are providing resources not only for victims, but for defendants as well, because they are all part of our community and justice dictates that. That was a very important thing when I flipped from from public defender to prosecutor. It's a very different way of looking at things. But I brought with me my understanding of people, their concerns, their needs, what brought them into the legal system, both civil and criminal, and how can I make that better? One of the ways I was able to do that was to collaborate. I was able to collaborate with the county and city agencies, helping as an executive committee member for the creation of the Family Justice Center, which I know you're all aware of, as well as helping with the Child Advocacy Center, which is currently up and running in some respects. That has been a really proud moment for me because we can really provide wraparound services for people, not only directly through what I would do as a prosecutor, but to make the community better for that particular individual. And I think that we would do that here as well, not only by adjudicating their concerns in a timely and appropriate manner, but also to be able to hear their voices and make sure that the process is transparent. It's important for all of those things to happen in something as important as this Human Rights Commission. Looking at defendants, however, they're a defendant until they're adjudicated. And what I was able to do was to help support things like the mental health docket, the Veterans Court docket, the human trafficking docket, the community court docket, and I'm missing one, drug court, of course. Being able to support defendants who then became, as I would term them, clients, because we are there to help them through the community and help them through all of the challenges that come before them, unique to their mental health, drug abuse, trafficking status, but also to make sure that they are really being heard and can have the support they need. And I've been able to do that and collaborate with county, local, federal, state agencies to be able to bring those resources here to Cleveland. As a prosecutor, which was very different from my time as a defense attorney, I was tasked with looking at very difficult cases. For example, police-involved cases, both on and off duty. They are often complex investigations, and there is no right answer for the community. Whether that community is law enforcement or whether it is our community as a greater whole, there's no right answer because something happened that someone was wronged. I was able to look at those investigations, sometimes redirect them to get additional evidence because I want to make sure I'm making the right decision. Take that evidence and information, put it up next to the law, and make a decision. Sometimes the political pressure wasn't necessarily what the greater community wanted, certainly wasn't in many cases what the law enforcement community wanted to see, but it was the right thing to happen. And I think that's what we would do here. We would listen to complaints, review them. Of course, they're going to be, when someone says, I have been discriminated against, that means something. It doesn't always end up that it's right or wrong. And what I found is that sometimes there are things that are wrong, they're not legally wrong. I have to go by the law and the case law, and if that's building new case law, that's what I did. But sometimes it's just wrong, it feels wrong. And so what I think this commission has an opportunity to do is to go forth into the community and sort of build some bridges. We can reach into the community to employers, to educators, to landlords, to everyone, and say, listen, we expect more from people here in Cuyahoga County because we love the diversity that we have here. We love the people that we have here, and we want them to feel safe in our community. We want us all to be able to come together and make this place even better than it already is. But that doesn't necessarily mean that there's merit in every claim that can move forward. So let's find a way to make that person feel whole. Let's bring people into their perspective, and you can make changes in the community that don't necessarily go through the great process that you have in the statute that lays everything out so that there is fair and due process in the process.
Can I stop you there just so we can open it up for questions?
I'm sorry,
I
know I'm a lawyer, that's my problem.
It's okay, I understand. We're politicians. We've been charged with the same loquaciousness, I guess, if you will. So it's okay. But I do respect what you bring to the table, and I would like to open it up to my colleagues. And I know that one of my other colleagues has to leave early, so I want to open it up if there are any questions. Councilman Miller.
Yes. I was not clear on what you said right at the beginning of your statement as to when people come before the Human Rights Commission, do you envision them coming with an attorney, or do you think that's not necessary?
Oh, I believe that it should not be necessary. I believe that they can come with an attorney, of course, but certainly they should feel comfortable to be able to come here on their own, and the process should be easy enough that an average person can come here and engage in this process on their own.
When you were Cleveland police prosecutor, did you deal with a lot of cases where people came in making complaints about their neighbors?
Of course, all the time.
And how frequently did these involve human rights violations or possible human rights violations, or did they mostly just involve they didn't get along with each other?
I think most of them, thankfully, were people who just didn't get along with each other for whatever reason. However, there were some that came through that could be considered civil rights violations or something of that nature. We would address those appropriately. We would investigate them fully. They were given a detective. Those cases were moved on to the county prosecutor's office if necessary in those matters. We took them very seriously when alleged.
And finally, just a comment. You remind me somewhat of what Senator Kamala Harris is going through right now, trying to see it from both the prosecution side and the defendant side. So I find that interesting.
Thank you so much. That's a wonderful compliment. Any other questions?
No, I do want to. I want to thank you, and only because of the time and the length of the agenda, and we do have two more candidates that we want to hear from. So, you're clearly by your resume and your presentation, you bring a wealth of knowledge and experience, and just from what I've been able to observe of you today, I think you will be a wonderful addition to the Rights Commission. So, thank you for your willingness to serve in this capacity.
I appreciate it.
Our next candidate is Timothy Downing. If you'll step forward, state your name for the record, give us a little bit of your background and why it is you'd like to serve in this capacity.
Good morning, Chairwoman Brown and esteemed members of this committee. My name is Tim Downing, and it is an honor and privilege to serve to be before you today. Thank you for the opportunity to speak to you. I'd like to thank County Executive Budish for placing his trust in me and making this appointment, and all of you for allowing me to speak to you today. As an openly gay man who has lived and worked in Cuyahoga County for 30 years, and as an attorney who has represented employers and employees in employment discrimination cases for most of my career, the creation of this commission has special meaning to me. Now, those who come to me asking for advice about what to do if they have either been accused of or believe they have been a victim of discrimination on the basis of sexual orientation or gender identity will have a place to have their grievances heard. This was not possible before because under Ohio and federal law, it's perfectly legal to not hire someone or to fire someone because of their sexual orientation or gender identity. I've been an attorney for 3 decades, have been named to the best lawyers in America, a super lawyer by Cincinnati Law and Politics magazine many times, and most recently in 2018, and have been named one of Cleveland's top-rated attorneys. During that time, I have helped publicly traded and privately held companies and their officers, directors, and senior executives resolve highly contentious and complex conflicts with customers, competitors, creditors, employees, and government agencies. And from time to time, I've also represented employees who believe they were not hired or fired from a job due to who they are, who they love, who they worship, or what they look like. I was also recently appointed the first ever Chief Diversity Officer of my law firm, Ulmer & Byrne, which is based here in Cleveland, but we have offices also in Cincinnati and Columbus and Chicago, Illinois, and Boca Raton, Florida. In this expanded role, in addition to still representing clients, I will oversee my firm's diversity and inclusion initiatives, work to increase the firm's internal and external diversity and inclusion programming and community involvement while overseeing its implementation and execution. I also bring a unique perspective as a result of the experiences I've had serving on not-for-profit boards across the country and here in Cleveland. Nationally, I'm the former co-chair of the National Board of Directors of the Human Rights Campaign, which over 3 million members across the country is the nation's largest LGBTQ civil rights and educational organization. I currently serve as co-chair of the organization's National Emeritus Council and remain on the board of directors. I locally am the president of the board of trustees of the Great Lakes Theater, Cleveland's classic theater company. I'm the former president of and continue to serve on the board of the Cleveland International Film Festival, and I've also served on the board of directors of the Diversity Center of Northeast Ohio. These professional and volunteer experiences have provided me a solid foundation that will enable me to serve in executing the laudable purposes and goals of this commission. Thank you again for the opportunity to speak to you today. I will welcome your questions.
Any questions, comments, or concerns from the committee? Councilman Miller?
First of all, thank you very much for your willingness to bring your broad expertise to this commission. And my question, am I hearing correctly the way you presented it, that you've handled a significant number of cases where you're defending businesses that have been accused of human rights violations as opposed to the other way around?
That is correct, Councilman. I've mostly handled cases involving companies that have been accused of discrimination, and in those cases I have worked diligently to try to resolve the dispute, short of litigation, and to help them put in place best practices at their own places of employment so they don't get accused of it again.
I think it's an important perspective. When we discussed this legislation last year, there were concerns expressed by some afraid that people who would be appointed that would not have the perspective to see it from the business side and understand the issues and problems that they're going through, and so I think it's very very positive that you not only have the human rights background, but you also have the perspective to see what the challenges are that businesses face in trying to handle these issues properly.
Thank you, Councilman.
Thank you, Councilman Miller. All right, if there are no additional questions, comments, or concerns, thank you so much for coming out and your willingness to
Madam
serve, and of course, your broad expertise that you will lend. Our final candidate is Todd Masuda. And again, if I butchered that, please correct me. If you'll state your name for the record, your background, and the reason you'd like to serve on this commission.
Thanks for the opportunity to talk with you today. I'm Todd Masuda. I'm a lawyer in private practice with the firm Schneider Smeltz Spieth Bell. I have the privilege of being nominated by Executive Budish to serve as one of 3 county human rights commissioners under the county anti-discrimination ordinance. I've been asked to talk about some of my qualifications. So I'm familiar with anti-discrimination law on the state and federal level through my employment law practice. The ordinance takes a lot of language from Ohio, the ORC 4112, the Ohio Civil Rights Act. So I expect the interpretation and enforcement of the ordinance to be familiar. I have also represented employers defending discrimination charges, but by far the larger part of my employment practice has been to counsel employers on compliance with the law and to encourage them to have fair and harmonious relationships with their employees. The new ordinance empowers the Commission to adjudicate a wide range of claims, but the Commission's focus will be on charges of discrimination on the basis of sexual orientation, gender identity, and gender expression in the realms of employment, fair housing, and public accommodation. We employment lawyers, like Tim, we're well aware of the absence of protected status for LGBT employees under existing law. And I think we're very well aware of the discrimination risks that those employees face. I applaud the council for passing the ordinance, and if I'm appointed, I'll be proud to serve on this. I believe that service is an important obligation for lawyers, and for lawyers in private practice like me, that doesn't just mean customer service, right? It means service to our community. In the past, my pro bono service has been related to arts and culture and refugee aid, but I'm excited for my first real public service opportunity. My other qualifications, in line with my other practice areas, which are corporate law and commercial contracting, I like to write policies and procedures, and I like to establish or formalize relationships between organizations. I think that'll be key in the early stages of creating the purpose and function of the commission. And so what are my other qualifications? I was raised in a tolerant religious family, so I don't have an anti-religious bias. So when our decisions go up to the Supreme Court, we won't have that problem. So I respectfully ask that you recommend my confirmation to the full council. If you have any questions, I'm glad to field them.
All right, thank you very much. I look to my colleagues. Councilman Gallagher.
I see you're an artist.
I have a background in the arts.
I only say this because my last class at Cleveland State before I graduated was Art 101. I had to find something to fit in there, and it was the most grueling thing I've ever been through. So I have great appreciation for art, artists, and everything you do. So you evidently have a talent that I wish I had, and I don't.
All right, thanks.
It's something about Councilman Gallagher and art that just...
The last class I had to take to graduate from college, I needed a PE credit. And looking at my schedule, the only thing that fit in between work and this other stuff and that would fit into my schedule was international folk dancing. So man, I kind of feel you. Right?
But you can't possibly appreciate international folk dancing like I do art. I hope not, anyhow.
So you take the class, Gallagher. Any other questions, comments, or concerns? All right. Oh, yes, Councilwoman Conwell.
Through the chair, how do you envision the commission's role, and will it be open to the public? I know some of these cases where individuals come forward as probably private information and they might not want it to be shared, but we have a 3-commissioner body with the PRC, and it is a very open and public forum. How do you see it moving forward? Or
I think that they have to be relatively confidential. It is a proceeding that will have to have confidentiality up front. I think procedurally, it's going to be real important for it to track the OCRC, because really what we're doing is we're creating a protected class. We're kind of adding a protected class that runs parallel to 4112. So the OCRC has an efficient system. They have forms, they have ways of doing it, they have investigators. And we're kind of expanding the way the law addresses it, but I think that because of the language of the ordinance and the established procedures we have with OCRC, I think it'll be best for our commission to track what OCRC does. I don't know, I don't know what it's like inside of there. I don't know what their procedures are inside, but I know what it's like from the outside, and I'd like to build a relationship with them so that we have a seamless referral system. Not just that we refer the non-sexual orientation cases over to them, but that if they can identify these causes of action that they can't address, if they could refer them to us, that'd be cool too.
And the OCRC is Ohio Civil Rights Commission?
That's right.
Okay,
Yeah.
thank you.
And because I'm just worried, we have an ordinance coming up next where it kind of combined the Human Rights Commission and the Cuyahoga County Equity Plan. And so just wondering how, if we're looking at equity and you guys are working on maybe a piece of that, how that commission or that Citizens Advisory Board under equity would get that information so it could be,
I don't know what the equity plan is, but right now, the hearing process that we have, it's just the 3 of us, and it's the ordinance right here. So as we put it together and as we plan it out, as we build those relationships, as we figure out exactly what we are doing, then it sounds like something we
you
should
could
talk
come
about.
back and share. Thank you.
I would like to follow up with Councilwoman Conwell and just make the request on record that once you establish the policies and procedures, that someone share them with us. I know this is going to be a kind of a work in progress, but for our level of confidence and the confidence of the public, I think it's important that we get those parameters and process and procedures out for everyone to fully understand.
Yes, I think it'll be important for everyone to know.
All right. Are there any other questions, comments, or concerns from this committee? There being none, I'll move this to the full body of the council under second reading suspension. Do I have a second?
Second.
It's been moved and second. If there are no further questions, comments, or concerns, all in favor, please say aye.
Aye.
All right, if you'll read the final item into the record.
Ordinance number 2019-0002, amending section 208.01 of the Cuyahoga County Code to provide for the periodic appointment of the Cuyahoga County Citizens Advisory Council on Equity.
Is there anybody here to speak to this item?
Madam Chair.
Councilman Miller.
Councilwoman Conwell and I worked together on this legislation, and I think we both can speak to it. Would you like for me to start, or
I would,
or
very much
Yvonne,
so.
would you like to start?
You can go right ahead. Dan.
Whomever would like to go.
Okay, my colleagues, as the council approximately 2012 or 2013 passed the equity plan, which was a comprehensive statement about equity issues, and as part of the equity plan, we created the County Citizens Advisory Council on Equity, which was intended as a permanent ongoing advisory commission. However, due to the press of other priorities and things going on, that commission never got constituted. As you know, the Human Rights Commission, which we're standing up today with these appointments, we created that last year, and also we created an advisory council as part of the disparity planning process when we put the results of the disparity study into practice. And so, as a result of these developments, we came to see it as probably somewhat duplicative to have a permanent ongoing citizens advisory council on equity. But nevertheless, we also thought that it would be useful if from time to time we had an advisory council of purely citizens come together and take a look at what we're doing in the broad range of equity issues, and to see if there's anything that we should be doing differently, to see if there's anything that we've left out, and to make a report. And so, as a result, we created an ordinance here that would change what we do from having a permanent ongoing commission to having a commission, a citizens advisory council on equity that's constituted once every 5 years for a period of up to a year to do a periodic ad hoc review of what we're doing on equity. So that's what the legislation does. And I would also mention that we met and discussed this last fall while the Human Rights Commission legislation was being worked on. We met with Chief of Staff Earl Lycan and discussed this with the administration, and they supported the approach that we're taking here. So hopefully the administration is still on board with this concept, and so that's what we've got.
Thank you, Councilman Miller. Councilwoman Conwell, is there anything you'd like to add?
No.
All right, it looks like going through the legislation, the first appointments would take place if approved in October of 2019 this year, and as you identified, once every 5 years thereafter. So it doesn't seem to need to move to the full body of the council under second reading suspension, so I'll just move this forward to the full body of the council. If there are no additional questions, comments, or concerns, do I have a second? All right, it's been moved in second. Is that okay? I feel like one of you guys should have moved that along.
Fine.
All right,
We're happy to have your support.
Okay,
We're
thank
honored.
you.
Thank you.
All right, so if there are no questions, comments, or concerns, all in favor, please say aye.
Aye.
All right, thank you very much. We had a hefty agenda today. Is there any miscellaneous business? If there is none, yes,
I
Councilman
have
Miller,
an item of miscellaneous business.
please
Would-
proceed.
I would just like to request of the administration, I know there's a number of key positions that are vacant and haven't been filled in the administration. And now, I'm not talking about boards and commissions here. I'm talking about positions at the director, executive staff, or sub-director level. And I would just like to, if the administration could provide us a list of what such positions we have currently outstanding that are open, because I'd like to get a handle on it. I think, as everyone knows, we're facing a few challenges right now, and I think it will be helpful if we can get the key leadership positions filled. So I just want to know where we stand on that.
Thank you very much, Councilman Miller. Any further questions, comments, or concerns?
I just wanted to
Councilwoman Conwell?
comment to Councilman Miller in terms of the HHS directors, everything, I think we have one open. So I've been trying to follow that as well, so the budget process will go smoothly as possible. And the only one, and it should be filled, it's down to the last wire, is Department of Senior and Adult Services. But all the other positions in terms of high-end leadership for HHS has been filled.
That's
And
good.
in coming in the next couple of weeks, we should hear a decision for Senior and Adult Services.
Okay, great. Thank you.
You both for that and the update, especially Councilwoman Conwell. And I just would like to add for the record, Regional Director Michelle Pomerantz and I have been in very brief discussions with regards to making sure that we have the boards and agency appointments added to our positions that are available through HR, so in that capacity, so that we can maybe broaden our pool of candidates while they have been very exceptional, but that is something that she and I have discussed as well, so that we can also be up to date as far as what is available and what is vacant. All right, so if there's no additional miscellaneous business,
Can
this
I
meeting.
ask one question?
Sure.
Can I ask one question through the chair to Michelle in terms of the website? Because as individuals want to be a part of the boards and commissions, they'll ask me what is the process, and I always refer them to our website. Is that being kept up and current?
Through the chair, yes. I've been working both with Deputy Director Janae Holly as well as Kurt Williams from the council staff to continue to help update and keep the information on that website up to date. There's always a few that are still up there that aren't in service anymore, so we're still trying to clean that up. But through the chair's mentioning, we would like to see if we can put some of these openings on the HR site as well, so that there's multiple ways for people to understand when there's openings to boards and commissions.
Okay, thank you.
All right, well, if there's no further questions, comments, concerns, or miscellaneous business, this meeting is adjourned.